Okay.
Hi, good evening. Good evening, everyone. Welcome to Community Board 3. This is actually a double meeting. It comes in two parts. The first part will be a joint meeting of the Health, Seniors, Human Services, Youth Education, Human Rights, and Transportation Committee meeting. And then the second part will be just Health and Human Services. Okay, so my name is May. I'm the chair of the Health and Human Services Committee. And the first thing that we will do before we actually start the meeting is that Larissa, our Zoom facilitator, will explain some procedures of the meeting. Larissa?
Thank you. Good evening and welcome to our committee meeting. This evening, I'd like to advise you that the meeting is being recorded. If you are not a committee member, we welcome you to sign in via the chat with your name and affiliation, if that's appropriate, into our chat for attendance purposes. The chat has been disabled for any other reason other than registering your information and asking for assistance if you have technical difficulties. So if you do have technical issues, just send us a chat and we will reach out and assist any way we can. During the meeting, the chair will be calling on people who have their hands raised who are members of the board. And anything else, please put it in the chat and I can reach out to you and answer any questions. Thanks.
Okay, thank you, Larissa. So the first thing we will do before we start the joint meeting and the presentation that comes with it is that we're going to take attendance. Each committee secretary or chairperson will take their own attendance, and we will start with the Health and Human Services Committee. Thomas?
Good evening, everyone. May Lee, obviously present.
Here. Yeah.
Larissa?
Present.
David Crane?
Here.
Eric Diaz, were you able to connect yet? Eric? Let's see if we get back to him. Shirley?
Here. Sorry.
Deborah? Is Deborah with us as of yet? Tatiana?
Yes.
Thank you. Paul Rangel?
Yes.
Heidi?
Here, yes.
Ricky Wong?
Here.
And Carmen Perez? Carmen? Okay. May, would you like me to also capture the other committee members?
I'll do that one, Thomas. Appreciate it. All right. So for Transportation Committee, Paul Rangel here. Michelle Cooper-Smith? No. Wendy Lee?
Here.
Lee Berman?
Here.
David Crane?
Here.
Felicia Cruikshank? I don't think she's on. Is Ellen Liu on? I don't think I saw her. I think I saw Tariq Ramos.
Here.
All right, we're good on our end. Thank you, Thomas, and thank you, May.
Okay, thanks, Paul. So since the presentation we're hearing tonight, it's sort of the issue originated in your committee. Do you want to introduce it? And then they can start. Paul?
Sure. Good evening, everyone. Thank you, everyone, for attending tonight. This was an item that was brought to us at our March agenda, on our March agenda for transportation. It was in regards to the Chinatown core and all the things going on down there. I believe, do I see Jan Lee on? I think I saw Jan Lee on before. We felt that this would be necessary to go to joint committee because it involved seniors as well. So I think Dominic is on to present as well. So I think it was necessary that both committees hear some of the results of some of the surveys. We're getting the results of the surveys today, Jan? So there was a survey that was being passed around about a couple months ago, but I will let Jan and Dominic talk about all that. So go right ahead and thank you.
I just wanted to say thank you, Paul, and thank you to the committees, for particularly the Transportation Committee, for putting a lot of work into considering the residents in the formation of a resolution regarding the mayor's idea to make street sheds permanent. And some of the some of our block association members, along with Welcome to Chinatown, felt that there was not enough outreach. And so that was the idea behind doing a number of different survey techniques to capture data, particularly those who are the senior community in Chinatown, which traditionally has been a difficult group to reach. And Dominic will explain, but we have worked in partnership with some of our larger social service providers, like Hamilton Madison House and Chung Pak Senior Center, Two Bridges, and others. And it is a work in progress, but I'll let Dominic take it from here. And maybe introduce yourself, Dominic, of Welcome to Chinatown.
Right. Yes, I'm Dominic with Welcome to Chinatown. I actually have an introduction slide, so let me share my screen. Right here. Okay. All right, so yeah, once again, thank you everyone at CB3 for letting us present on outdoor dining today. I'm Dominic, I'm with Welcome to Chinatown. With me on the line is also Jimmy Pan, my colleague who contributed to the development of this report. So just a quick introduction to who Welcome to Chinatown is as an organization. We're a nonprofit formed at the beginning of the pandemic to support Chinatown small businesses. Some of the impacts we've made so far, we've put back over $1.5 million back into the neighborhood. We've directly supported over 80 small businesses. We're over 50 volunteers strong. We have over 29,000 Instagram followers. And we've been recognized by Councilmember Chin and New York State Senator Kavanaugh for our work. Our mission is to ensure that Chinatown will always be open for business. So before we get into the surveys themselves, just some notes we want to be careful to say. We aren't a professional polling firm, nor we have polling professionals as volunteers. So we aren't making a claim to say the end all be all scientific poll of Chinatown here. We also are careful to note that this is not the entirety of CB3. So we request that no resolution be made based on our data alone. And lastly, we do believe, though, that our data presents important insights we hope will be useful for planning the future of outdoor dining in Chinatown. So just why did we survey about this? And so Jan got into some of the reasons as well. So as an organization, we're invested in the growth and sustainability of Chinatown, including the future of outdoor dining in the neighborhood. And we also want to note, that outdoor dining isn't new to Asian cultures. If you look across Asia, there's night markets, or in particular, Cantonese Dai Pai Dong. And even one of our storefronts that we surveyed said that the Chinese cuisine industry can use outdoor dining as a way to rebrand their restaurants to a more popular audience. Western customers tend to associate outdoor dining with Western cuisine. All right, so look at the 3 surveys that we did. Number 1, we surveyed Welcome to Chinatown's Instagram following and email newsletter subscribers. So these are folks who might not necessarily live in Chinatown, but are invested in the neighborhood's future. The second group that we surveyed were Chinatown storefronts. And we believe that Chinatown small businesses are going to be impacted by outdoor dining, whether or not they have outdoor dining structures themselves. And lastly, as Jan mentioned, we worked with partner organizations to reach Chinatown seniors. As you can see, Two Bridges, Chung Pak, and also the Chatham Towers Co-op. This group, is amongst the most vulnerable in the neighborhood, and we've heard complaints that it's become more difficult for Chinatown seniors to navigate the new pedestrian environment created by outdoor dining. So a look at our survey samples that we got. The Instagram group, we got 421 respondents. This group definitely skewed younger, not a surprise, it was done via Instagram. 90% were 18 to 44 years old. And this group was in fact involved in Chinatown. 82.7% said that they visit the neighborhood at least once per month or are neighborhood residents. Next, the Chinatown storefronts. We got 197 respondents via door-to-door canvassing. This was a varied group of businesses, restaurants and so forth. That other there includes retail, barbershops, beauty salons, and so on. And also, this group wasn't just a bunch of places with outdoor dining. Only 21.8% of this group used outdoor dining structures. And then lastly, the seniors group. Our partner organizations got 151 respondents. The majority of this group were over 65, 80.8%. And lastly, these were Chinatown residents. 90.7% of surveyed individuals live in zip codes 10002, 13, or 38. So let's take a look at the survey data. So we asked the Instagram group and the seniors, have you dined outdoors in New York City at least once during the pandemic? And we asked this because we believe that who uses outdoor dining is a good indicator of who benefits the most from it. And so the Instagram group, 86.9% said that they had in fact dined outdoors at least once in New York City during the pandemic. Takeaway there, younger consumers in Chinatown are likely to have dined outdoors. But by contrast, the senior survey, 70.2% of respondents said that they had not dined outdoors at least once during the pandemic. We also asked all groups, do you want outdoor dining to continue in Chinatown after the pandemic? In our Instagram group, it was a resounding yes. 92.6% do want it to continue in Chinatown after the pandemic. Younger consumers in Chinatown do strongly support continuing outdoor dining in the neighborhood after the pandemic ends. Our storefront group also had a majority support for wanting outdoor dining to continue. 36% said that they like the program as it is right now. 29.5% said that they would like it to continue if the program is improved. And also only 25.4% of storefronts surveyed said that they do not want outdoor dining to continue in the neighborhood after the pandemic. And interestingly enough, this didn't vary by business type. There was a majority support for the continuation of outdoor dining in Chinatown, whether or not you were a restaurant or a grocery store or a bakery, so on. And it also didn't vary whether or not a business had outdoor dining. So the thinking there is, if you have outdoor dining, maybe you have a vested interest in it continuing. There was definitely variation, but there was majority support amongst both groups, outdoor dining or not. However, we also do want to acknowledge that just because there is majority support, this community board has also heard complaints about the outdoor dining program as well. So we asked those businesses that did have outdoor dining structures, if you would like to invest more in your outdoor dining structure, but can't or won't, why not? And select all that apply. And the top 3 complaints you'll see there, 34.9% say that outdoor dining rules are unclear and or changed too often, preventing a long-term investment there. 32.6% of respondents said that there wasn't enough money that they had to invest more in their outdoor dining structures. And then 42% of those businesses said that not enough space was on the street in front of their business to make such an investment worthwhile. And lastly, again, turning to the seniors group, by contrast, you'll see that a majority of seniors do not want outdoor dining to continue in Chinatown. 67.5% of respondents said that they do not want it to continue in Chinatown after the pandemic, as opposed to just 4% who like it how it is currently, and 15.3% who would like it, but if changes are made to the program going forward. So, some takeaways there is that consumers and Chinatown storefronts alike do support continuing outdoor dining in the neighborhood, but seniors are far less likely to have dined outdoors or support the continuation of outdoor dining. And so we believe that these are strong indicators that outdoor dining currently doesn't meet Chinatown seniors' needs. And so we wanted to get into, maybe look at why this group might not, why that might be the case for that group. And so we asked seniors, do you have any mobility issues, such as using a cane, walker, wheelchair, or crutches, or otherwise having another mobility impairment? And a full half of the group that we surveyed said that they in fact did have a mobility impairment, which would make it more difficult for them to, we would imagine would make it more difficult for them to navigate the new pedestrian environment. We also asked seniors, have outdoor dining structures made it harder for you to walk around Chinatown? And if yes, select all that apply. And 68.9% of survey respondents said that outdoor dining structures make the sidewalk too narrow or obstruct the sidewalk. 19.9% of this group said that trash receptacles associated with outdoor dining obstruct the sidewalk. And 23.2% said that electrical wiring on the sidewalk, associated with, say, the heating elements, makes the sidewalk uneven, which would pose a difficulty, I'd imagine, especially for, say, a wheelchair user or a walker user, or just someone who's uneven on their footing. So just to recap, an overall summary of our findings here: consumers and storefronts surveyed strongly supported continuing outdoor dining in Chinatown, but by contrast, Chinatown seniors surveyed were strongly opposed to continuing outdoor dining. And so we believe the key problem to consider here is, how can outdoor dining in Chinatown meet the needs of the neighborhood seniors better? How do we ensure adequate pedestrian space for them? And yeah, thanks for listening. I can take questions. This is just a selection of the survey results that we're prepared to present today. Full survey results will be forthcoming on our website. And also, just to keep things concise, if there's any sort of general questions about our organization, you can email them to chinatown@welcometochinatown.com.
Right. Thank you, Dominic, for not being a professional polling firm. This was pretty damn close. So it was a great job with the information. So thank you all for coming on tonight. I know we had already touched on it a little bit in our March meeting at transportation, but I do have a few questions just to start off. Just in one of the slides, I don't know if this is in any of the slides, what percentage of the population in Chinatown are seniors?
Jen can
I'm in contact with Asian American Federation, who actually keeps pretty current records regarding this. It's over 1/3 of our population in Chinatown is over the age of 65. Of that group, we have 1/3 of that group counts themselves as having mobility issues.
Yeah.
So many of those people are low income, and a vast majority of that group is also living under the poverty line. So these are people who rely very, very much on very localized food networks and food sources, whether it's a local cafe or restaurant, or whether it's a place to buy groceries. So we find that they don't actually leave the neighborhood that far, for those reasons.
Okay, great. Thank you. No, thank you for that.
I just wanted
Matt.
to comment, Jan. Yeah, that sounds right. Well, and I just wanted to remind also Paul. Maybe we need to refer to it later. Or anybody. We had an intern. Or a consultant help us to analyze the census tract by census tract, the age groups, and it's on our website under resources. So if you need more information, you can go back to it.
Okay. Thank you, Matt.
I also wanted to add that some of the social service providers and housing providers, low-income housing providers, we concentrated first on such groups as Chung Pak and Two Bridges, and we're also working with AFI and also CPC. Any of the organizations that traditionally service the low-income senior community in Chinatown, because they are the ones who are on the ground here, particularly during the pandemic time. So those numbers are always changing. There have been some folks who have moved out, lived with their relatives somewhere else during the pandemic. So things may change as we move out of the pandemic, but also the 151 respondents is just the beginning. Dominic and I were hoping to present at least 300 survey results by the time we met with you folks, but some of the information has been slower than we anticipated in coming back to us. But we hope to be able to give you a little more updated once we start hearing from some of the other organizations with their data surveys. And we would welcome your committees to add on questions if you think it would be pertinent that's missing in our data. But I do want to compliment Welcome to Chinatown, because they have been, as you said, Paul, you can see the quality of work that they are able to provide. So partnering with groups like Welcome to Chinatown and the groups that I mentioned earlier has been very rewarding and also so important because as far as we understand, and maybe May could correct us, there isn't any survey that has reached out to this particular sector within the community, which is the seniors who don't have, laptops, they don't have cell phones. We had to do it the old-fashioned way, which is paper surveys, make sure that we got them to fill them out and also return them to us. But we did get help from Two Bridges, who digitized the survey, but then put it on a tablet and literally went door to door so that they could check it off for them and also record their comments. And then they sent those to us electronically. So we have the paper surveys to back up these numbers, but also the digital copies as well. So we're not exactly sure if this is the absolute best way, but it seems to be a good combination of paper survey and, when possible, to have them actually survey folks when they're all, hopefully the senior centers will open up again, and then we'll be able to do this in a very efficient way.
All right. Thank you, Jan.
Susan
Has her
question.
hand up, right? Yeah.
Thank you. First, I want to compliment everyone who did this work and the amount of work that your volunteers did. I think it was just amazing. As far May referred to the information on our website, I just want to, if anyone has any trouble finding it, please let me know and I'll send you a link. We also have on the website under member resources, but it's accessible to everyone. Planning fellow several years ago did a survey of built environment for seniors. And I believe it covered part, it was a small area, but I believe it was in Chinatown. I would like to ask, when you're mention what changes can make the situation better, are you going to pursue that? Are you going to propose changes?
I think it would be good to come back to these committees because when we ask the question, we're not asking the seniors or asking the people who are most affected what they recommend. We're just asking them, what do you find on the street that is your obstruction? So I think it requires perhaps, Susan, another meeting. We could get back together with you with a deeper dive. It is something I think that we've been told. Our block association has been recommended to us to inform this committee that perhaps similar surveys through similar groups within different areas in CB3's district could disseminate into different languages and also different communities that are not within our reach. So it would be good, for instance, to have something on the eastern side of CB3 and the northern side of CB3 so that we could accumulate and see if this data for this particular group of people dovetails with what we're finding.
Okay. I just want to let everyone know there's a citywide text amendment that will be certified soon. This is for open restaurants, and we just found out yesterday. We found out information about it. I'm getting more information tomorrow, but it'll be certified in the beginning of June. So it will be on our agenda. And I'm not sure which committee at this point because it covers a number of committees, but it'll be on the agenda in June and July. So please look for it. What that text amendment is going to do is remove all zoning restrictions for sidewalk cafes. And it also, even better, sidewalk cafes will no longer come before the community board. They'll be as of right. So I think it's important to get as much of your information out before then. And I want to ask you also permission from, if you could give me this, this slide deck, I would like to forward it to people I'm working with at DOT.
Absolutely.
Yes, and also Dominic and I'm volunteering Dominic, but as busy as he is, but we could also present anywhere you think it's important for us to present, in the way that we're doing now, because I think it's important to capture this information, memorialize it in a certain period of time before the beginning of June. But we appreciate you letting us know, Susan.
Thank you.
Oh, yeah. Oh, Jana had a question, or you were talking about deeper dives. So my I mean, what Susan, everyone is saying, my understanding is this outdoor dining has been made permanent, but just in terms of the seniors, if you're, I mean, when the senior center is open, you know, and you're still doing the surveys, I'm sure you'll get many more seniors, but it would be good to know more about the responses amongst the 65 age group, like to divide it up more. I mean, there's a difference if you're 65 or 85.
Yes, yes.
And then you said, you know, most of the seniors you surveyed don't go to outdoor dining and don't seem to like it, which makes sense to me because that's what I hear too, you know, just anecdotally. But I was wondering if, is it because of the way outdoor dining is set up, or they just don't like it, period? So I don't know if you asked that question.
So
That's,
I'd say, you know, I'd love to have sort of like crystal ball into the minds of, you know, because we can only ask the question,
Yeah.
you want it to continue. And I guess because those sort of interactions that we have with seniors, you can't exactly present alternative versions. And I guess it really depends on how willing they are to take that sort of leap of faith to check that sort of like second answer choice. Yes, but if it's improved. I don't know if that answers your question.
yeah. Well,
Like-
I guess it's more like a focus group, what I'm talking about, you know, it requires that kind of a thing. So there's another project.
There's three things I think that are not captured, but I've heard anecdotally just from even my own relatives who are in the neighborhood. There's three things. One is economic, because the senior community may not be able to afford to sit there because there are surcharges, but there's also this is not the type of eating that they would do habitually anyway. So there's an economic hindrance, but there's also just the fact that this is a change to their lifestyle. One of the things that we are not able to capture is, and I believe this is something perhaps we should discuss further down the line, which is what mental challenges have occurred for our senior community whose habits and environment have been drastically changed. And having been the caregiver of both my parents and also other older relatives, I understand that changes in environment can actually cause people to change their behaviors in unexpected ways. The other thing is COVID-19. They did not want to be in an enclosed space. So I've heard examples which are kind of, you know, I think of them as funny, but they're not so funny, where seniors have actually ventured out, whether to go to work or to do other things, and it's their kids who tell them, don't do that because you're in the age group that's very vulnerable. So they may be overly cautious in our view, but in their household, they're trying to protect their health. So I think that these enclosed spaces were seen as something that they probably were advised not to do at some point.
Any other questions? I don't see any hands raised. Oh, Susan, did you raise your hand again?
Yeah, I just want to make one comment. You mentioned about this has been made permanent. The open restaurants has been made permanent, but none of the details have been made permanent yet. So this is why all the, but they will be within the next few months in city council. So it's really important to get this information out and to advocate in the next few months.
Oh, okay.
And along those lines, Susan, maybe you could enlighten us, because I'm actually not that clear. I was told that the mayor has to have a zoning override. Is that what they're discussing about in the beginning of June? That there's actually a zoning change to allow the use of public space?
This is not about use of public space, but I think when you say zoning override, I think that's probably referring to the citywide text amendment, because it is a text amendment to the zoning resolution. And the zoning resolution at the moment does not allow sidewalk cafe, basically commercial use in residential areas. So this will eliminate restricting sidewalk cafes, because the sidewalk dining and curbside dining is going to go away and be replaced by, something on the sidewalk. You know, what's going to be permanent is going to look more like sidewalk cafes. But what they're doing is they want to, this is what they're aiming to do, is to get rid of the zoning restrictions for that commercial use, and also the advisory votes by the community board. It'll all be as of right.
And so there's two more questions I have regarding that. One is, do you know, or maybe May, do you know of any survey that has been done for the ADA community? Because we're very concerned if we have seniors who are have mobility issues. Has anybody actually done a survey regarding the street seating for the ADA community? And then I guess that was the first one. That was my question. And if so, maybe that's something that should be done.
So I have actually I've been incredibly amazed that the disability community has not organized on this issue, because it's just, I'm flabbergasted. I have actually recommended to a number of community groups that I've spoken to about this, that they might want to contact places like Center for Independent Living and places like that. Nobody, it's just not happening. I don't understand why.
Okay. You know, maybe we might start reaching out, but at least this is a start, but thank you. Oh, I know what the other question was. Landmarks Committee, have they discussed these permanent changes? Because landmarked areas throughout the city are going to be permanently changed. And I think that it's unusual to have structures in landmark districts that are not landmark conforming. So in other words, if we didn't have a pandemic, would any of these structures be permitted in a landmark area without really, really vigorous dialogue and consideration? So I'd like to know if the Landmark Committee is going to discuss this.
Well, it's really good point, but what I'm understanding without actually seeing the text amendment is that the permanent rules for open restaurants is I don't expect that the structures are going to remain. You know, this executive order expired, I believe, the end of September. I don't believe what we're going to see permanently is going to contain these structures. But it's still, we still have historic districts and sidewalk cafes. I assume there might be issues with sidewalk cafes in historic districts. I don't know. It's certainly a good point to investigate.
Okay, thank you, everyone.
Jan, I just have one
Thank
more
you.
question. I imagine that you're going to want to come back one more time with to either one of our committees or another joint committee meeting with asking us for a potential resolution on anything involving seniors.
We would like some feedback from CB3 on perhaps who we could share our survey with in neighborhoods that are, you know, outside of Chinatown, because we have concerns after surveying this particular group that this may be prevalent throughout the district, and we would not want CB3 to make a resolution just based on Chinatown alone. So if you guys could just send us email and perhaps groups that are similar to Welcome to Chinatown or other core block associations that may have access to the Spanish speaking community or communities you know, in other parts of the district, I think that would be very helpful before we came back to recommend a resolution. Is that, Dominic, do you agree with that?
Makes sense.
Okay, to start with, as a starting list, we have on our website a list of many community groups, including yours. So I think you know where that is. That's a good start. And then we can all be in touch, I think, with other, you know, probably everybody has groups they could recommend in addition.
And
Yeah, also one of,
yeah, go ahead, May.
no, you were asking about other groups. So one of our committee members who's actually not here today, I don't see her, Carmen Perez. She is the director of the NORC at Cooper Square Committee. So that's, you know, little bit more up north. So we can ask her if they're doing anything or they know about this.
Thank you so much.
From the Transportation Committee, is there any questions from Transportation before I think this item gets wrapped up for the night? If not, Transportation Committee is good. May, I guess it goes right to you now.
Yeah, I don't have any other. I don't see other hands raised.
So I guess for Transportation, good to sign off for the rest of the night. Thanks to the Transportation Committee for coming on tonight, and I get to stay on. So I will see Transportation Committee on Tuesday night.
All right, and I'm going to give another shout out to Jimmy and Dominic. Thank you guys for all the hard work, and thanks for working on this with everyone. And thanks for the other members.
That was great.
Thank you.
Okay, thank you. Okay. All right. Okay, so now we're on the Human Services agenda. Okay, so just about the minutes of the last Human Services meeting, were there any changes or objections to it? If not, they're deemed approved. All right, so I guess the minutes have been approved. Okay, so our next agenda item will be to finalize the committee goals. So I sent that out. It's a shared Google document. Oh, Thomas, do you have it up?
Looking
The
to get
committee goals. So
Yeah, looking for it.
May, I believe I have it. Oh, no, well, I have the district needs for 2020. Sorry. Hold on. See if I can
it's
find
the
it.
one as last time. So okay, so while you're looking for it, if you can't find it, let me know. But our goal today is to finalize the committee. Or today we will finalize the committee goals that we worked on last time. So since the last meeting, I've learned that the deadline for completing, for all committees to complete their goals is the end of this month, May 31st. So we should finish it up today. The goals, all committee goals will be posted up on the website under member resources so that they can be used as a tool for our work in the next year. So also I reviewed the people look at the document since then. I know I made a few changes, and one of the things that we talked about for the committee goals is some of them really belong in, they're like, you know, budget and funding type goals. So we don't need to have it listed as a goal. They can go directly into our work on, you know, budget priorities and district needs. And that's coming up soon. We won't have all the answers that we need, you know, by May 31st, because it's, you know, going to go on. There'll be meetings in June, July, and then September, so that so it can be ongoing work, but it won't be listed as a goal. Oh, Larissa, did you want to share it then? If you have, or should I share it?
District needs, I can share.
No, not district needs, the goals.
No, I'm still looking for that email. Sorry.
Okay, I will.
I had it up.
I'll
I had
share
it
then.
flagged, but I'm not sure if you can.
Okay,
Sorry.
hold on. Let's see if I'm. Oh, can you let me share? Oh, look, can you let Maylee's computer share?
Sure, I'll allow Maylee's computer to share. Give me one moment.
Oh, actually, Thomas should be doing this.
Okay, you should have
me.
permission now.
Oh. All right, so here it is. So what I did was okay, let me go to the bottom first. So at the bottom of the screen, at the bottom of the page, I took all the goals that we said that were related to a budget. So that's health and telemedicine, funding for schools in CB3 area, and funding for technology for students and families within CB3. Just put that at the bottom of the page. And we don't have to talk about this now, but that can be put into the budget process, which Susan will later, when we talk about district needs, she'll go over the timeline for that. So what we have left right now is, I'm going to go back to the top of the page. So we have a topic on social inequities, nursing home beds in Community District 3, homelessness, and finally, new school at Essex Crossing, and K-12 students in CD3 with IEPs. So that's 5 different goals. It's a lot of goals. We are to finalize it today.
So may I
Should
have
I
a
share this
question?
in the yeah,
Oh,
should
oh,
I
sorry.
share this in the chat or do, go ahead, just
Uh,
ask a question.
Yes, so are we looking to prioritize these or expand on these tonight? Because I was looking at a few that over the weekend that I think may require a little more time for us than others.
A little bit more time in figuring it out.
Well,
We have only
more
till
time,
tonight.
more meetings. No, I'm talking about over the year. These are our goals for the year. There are some of these goals we may be able to accomplish quicker than others.
It's okay to accomplish it quicker, but the timeline
Um,
is 1 year.
No, I just mean like which ones we should prioritize or like, I don't know. It's just my question.
The other
No,
committee.
these are the goals that we will, so these are the goals that we will all seek to accomplish in 1 year. Not maybe, but our plan is to do it. Do you
Maybe.
understand, Larissa?
I do.
Yeah, would you be able to share that in the chat so we can edit?
Okay, hold on. I'm gonna stop this for a second and I'll share it in the chat. One moment.
May, you can try it again. I've changed the chat parameters. You should be
No,
able
yeah,
to share.
I'll just share it with everyone. It doesn't matter. I'll share it with you. I can only share with everyone or just you. But it's Thomas who needs it.
Oh, you can share with everyone now.
Oh, sorry. Okay.
No worries.
Try. You see that, Thomas? Oh, David, you had your hand raised.
Yeah, I was responding to Larissa. No, we do not need to add to this. We need to subtract from it. Five goals that we're actually going to achieve when each of them is clearly many meetings. It's not a list of goals. It's not certainly a list of achievable goals.
I agree, David. It is an ambitious list.
Yeah, so we should reduce it to a list that we can do. Because
So
like
in
I
that
said, it's
sense,
going to be on the website and at the end of the year, we're going to look again. Oh, go ahead. I'm
So
sorry,
in that
David,
sense,
go
yes,
ahead.
prioritizing which we want to keep. So, in that sense, prioritize and then decide, well, the lower priority ones, we won't include them on the list this year. That might be a good approach.
I
Thanks. That's
agree.
kind of where I was going with that, but You said it much better. I appreciate it.
Oh, Thomas, did you want to share? I think people need to look. Did you?
I'm clicking, give me a second. I need to be put on as a host to share. Larissa, can you?
Thomas, yes, you have permission.
All right, thank you.
Yeah.
Perfect. Does everybody see that?
Yes. Can you make it full screen?
Sure.
Thanks.
Better?
Absolutely. Yep.
I'll make it a little bigger too. There we go. Okay, so how do we want to approach it?
Let's start by reducing.
All right. So we're at social inequities. The first one seems a little broad.
Sounds to me like, because we've done things in the past which have been productive, like having a panel discussion and then coming up with, I'm not sure we would distill it into something, but usually, maybe it just goes into district needs. But we certainly inform ourselves and realize things that we might want to advocate for. Is that what someone is thinking when they're advocating for this social inequities?
I mean, in light of what we just heard and where we're going, like the school reopening in September, it might be productive to have maybe panels about seniors, about re-entering the schools. Those would probably be two strong topics that we can address and like really get some action based on the whatever the panelists present. Tell me, maybe we can make it more specific.
If it could be to develop a social inequities, the kind of things here district needs. This sounds to me like, even the phrase facing the district. Is it coming up with a good district needs statement? Because district needs statements, I don't know.
Susan, you had your hand raised.
Yeah, I think that was actually my suggestion, and what I was thinking of was sort of on the line of what David was saying. We don't know the specifics. We know that there are more inequities than we even knew. And my thought was to have nonprofit organizations who are working in specific areas. It might be seniors, it might be youth, it might be, the schools, to have them talk about the inequities they saw within their organization, working with their populations for both district needs and then district needs as a means, once you have a position to advocate.
But if it were for district needs, we'd have to do it fairly quickly. Or
Right.
else it would be for district needs next year.
Or it could be something that you can continue, you could start doing, and what information you have might go in the district needs, but you could continue it afterwards to still understand what the inequities are specific to our district.
Okay. Did we want to identify, if we do this, do we want to identify the populations now?
Cam?
Or
Certainly sounds like a step if we were going to try to come up with plans for getting information about the different ones, different populations. Identifying the population sounds like step one.
And then step 2 would be the organizations. And, you know, for youth, it could be both education, which would speak to the broadband also, and providers that do after-school programs, that kind of thing. Or you could have that as a following next step, you know, just say to include the following steps, identify the population and organizations, that kind of thing.
Larissa, did you have your hand raised?
Yes, I do. Susan, you touched on exactly what I was going to mention about the broadband. The broadband goes into the overlaps with schools and having access. So a lot of this, the social inequities overlaps with a lot of our other goals. So it could strengthen our arguments in other areas as well. For example, healthcare at Gouverneur, our community advisory board, we have a task force that is looking into healthcare inequities, which has been highlighted strongly during the pandemic, and we're getting a lot of data on that. So I think this is a great time to attack this issue. I think we'll be able to get a lot of information, and it will bolster a lot of our other goals as well. So schools, homeless, healthcare, seniors, it touches all areas of other goals that we have.
Okay, so it's what I'm hearing is that step 1 is to identify the populations. Step 2 is to identify the providers who serve those populations. And then step 3 is to actually invite them and come to speak.
Right.
Does anyone else have any comments on this? Oh, David, you're raising your hand.
Let's make a text change under 1-year goal and state what the goal is. Because the goal is to develop a section of the district needs to provide better understanding of social inequities facing the district.
I wouldn't limit it to district needs because, as May said, it's going to keep going after the district needs.
Yeah, so how would we measure that we have a better understanding of social inequities facing the district?
Well,
By how
maybe
many
instead
steps
of
we
better
do?
understanding is to gather information. I'm just going to say that it's not the exact word. Instead of better understanding, to gather better information with the goal of advocacy regarding social inequities for specific populations within Community Ward 3.
Also doesn't sound like a goal of something to be accomplished. It's a ongoing activity.
Well, that's true. But the result is for us to know what these social inequities are. Right now, we do not have specific information as what they are, and we want to know what they are so we can advocate for them.
Right.
So can we say to
We can
identify?
certainly do all that and still have the goal be to capture it in the district needs statement. I mean, as we all know, that those can be used for many purposes, and we certainly pull from the district needs from time to time. I would
And Thomas,
suggest
what did you
that-
say?
I like what Thomas
Can we
said.
put identify the social inequities facing the district, and then we can
Yeah.
talk about reaching, identifying issues and the providers? I mean, would that be an adequate goal? Instead of saying better understand, saying identify social inequities?
Yeah,
Yeah, I
that's
think
good.
that's a more
I don't
solid
know.
goal.
It is identify.
You do?
It's
Okay.
Yeah, because we need to first identify what they are, and
and
that's
for the
that's
purpose of
accomplished.
that. I'm sorry.
No, go ahead. Sorry.
I was going to say for the purpose of advocacy, and the district needs as part of that advocacy, but when the district needs is voted on, we'll continue gathering information.
Sure. I still think this is not any better as a goal. And I don't think that stating something like district needs is in any way limiting.
Well, I mean, you could say the district needs, including the district needs.
Yeah, that might work.
I mean,
I mean, after we get all the stuff, you know, we have these speakers come, we could write something up on it, couldn't we?
you can, I mean, you can't really identify, I mean, David's talking about linking it to district needs. You really can't identify your needs until you know what the inequities are. And then the needs, then you can, the next step is to say, what are the district needs to resolve these inequities or mitigate these inequities? And I'm not suggesting you add all that into this. I think that's much more that needs to be in here.
Does anyone else have anything to say? Thomas?
Do we want to keep that section that I highlighted, or do we just want to just say identify the issues, identify providers, and then what was it? To invite them to speak, or invite them to be panelists? Was that what we said?
Identify providers and invite them to present to the committee.
Yeah, and that whole number 1 you can delete.
I also kind of feel as we go through these, we're getting pretty bogged down. The important part is not the steps to take. The important part of this kind of an exercise is to state the goal clearly.
Yes.
So I don't think we need to keep adding detail under steps for each of these 5.
I agree.
That was just for us to make sure that we could do it in a year, that's all. But I'm not sure if
That's
it's
excellent.
required for us to list it, you know, in the final thing that we submit.
Yeah.
Should I leave it for now or take it out?
Just leave it, but when we submit it, we'll take it out,
Okay,
because they're not asking us to identify all the steps.
all right, no problem.
It's just done so we make sure we can do it in a year. So we look at those steps and we think that we can do it in a year, you know, given everything, then you know, it's considered to be doable. All right, so we'll move on to the next one since there are no other questions. The next one is about the nursing home beds. So basically, we have 2 things for sure. Okay, so it's about the nursing home beds. We need to, I added some text about what the goals should be. So basically we have to follow up regarding the AG settlement with the Allure Group. But before that, we have to find out what's happening at the state level, because a lot has happened regarding nursing homes and for-profit nursing homes. And we need to understand how that will impact the settlement. Okay, how does everyone feel about this? Committee members?
I don't believe anything, this is Larissa. I don't think anything should be added to it. I think it's pretty well defined.
Okay,
I agree. As a fairly new member.
Oh, thanks for having my back.
To me, it looks like 2 agenda items.
Yeah, I agree with that.
all right. Okay, so let's move on to the next one, which is homelessness.
Are we going to split this, or is it going to remain the same?
Yeah, can we address what David was saying?
Well, what I'm saying is that I
Yeah.
don't think it's a goal. I think it is 2 steps to be taken.
Okay.
So what would be a better definition of the goal?
I would say, in my mind, this is priority number 5 out of the 5. has listed without a goal that could be achieved. It's simply 2 agenda items, which we should do.
Oh,
You know, I suspect that there are professional nonprofits that have this nursing home bed information. You know, I think there are nonprofits that focus on that. And perhaps instead of making it a goal for us, we could ask, you know, identify one of those groups and ask them to come in and give the information to the committee.
you mean regarding the state stuff?
Well, I was thinking the state stuff, I think the AG's office can update us on the state stuff. I meant to evaluate the nursing home bed situation. You know, I think there are other organizations that do that professionally.
Now, the concern was are we concerned that we're losing more beds? That's why we want to evaluate this? Like, why are we evaluating it?
Yeah, I think that's the point. The goal should be, I'm assuming, to increase the number of beds in the community, right?
How
Yeah,
do
well, we already lost a lot of
We've
beds.
lost
It's not-
a
we're
lot
not
of
losing, we
beds.
lost them all.
So
We
that's
need
what
them
I'm saying.
back.
So the goal is to increase it. It's not to, like, part of the steps to increase it, I guess, would be to evaluate it. I'm agreeing with what David said. I think it says evaluate and get information, or, you know, previously we're saying identify the issues. We know what the issue is already. You
How
lost
did-
nursing home beds, you want nursing home beds. The goal should be to increase nursing home beds.
How does a community board increase nursing home
I have
beds?
no idea. But I think that's the
Neither do
goal.
I. And I just suspect that there's no way for us to do that.
You know, I actually I'm wondering if this is just like, well, I didn't mean to evaluate. I meant just that, you know, in the last year, there were a lot of changes, you know, and there might be legislation about, you know, how for-profit nursing homes, you know, how they start and how they operate. So just, it's more about understanding how that affects the settlement with the law group. But I'm wondering if, I know some people might not like this, but if we should not make this a goal at all, but make it like just a couple of agenda items in a meeting, unless we can, you know, reword it as a goal. But just simply to do those things in my mind.
You can always have the situation and lack of nursing homes be one of our needs in the district needs statement.
Well, I hope it is. I think it is.
Well,
There's something in there about it. There's not?
No, I think there may be. I don't know how good it is or
Okay.
how much data there is. But what I'm saying is, instead of having it a goal, have it part of the district needs.
Right.
Continue have it part of the district needs instead of a goal, and then have the AG office as an
Right.
agenda item.
The way that the community board can influence this, and I don't know that it can be stated as a goal, but it really is focusing attention on the thing. You know, maybe elected officials might take more attention if we had this at one of our meetings. Perhaps there might be media attention that happens because of it. You know, it's like being an influencer. There is really literally nothing we can do to make it happen.
Yeah.
There's probably nothing that even legislation could do to make it happen.
Well, I would suggest, you know, having a good statement in the district needs, and then you can use that to take that and use that as an influencer.
Well, could we just change the goal to focusing attention?
Or does it even need to be a goal? Like I can understand the argument David is making that this may not be an item that has the longevity of a goal, but definitely something we could focus attention on during our meeting and making it an agenda item. And I think those are all great. They're
also
doable.
a funding thing for health. You know, it could be, since we have city nursing home beds, you know, that could also be a funding agenda item.
Okay, so let's do that. I mean, what I'm hearing is that this will not be one of the stated goals, but it falls into several things we need to do in district needs, in funding, and having it as an agenda item in 1 or 2 of our meetings.
Can I ask if Deborah is here at the meeting? Because I'm
No, she's
certain
not.
that she has opinions on this.
She's not tonight.
Thoughts. Okay, maybe there's someone who is part of the group that Deborah works with, someone from the public.
Not right now.
Not seeing anyone in the chat who's mentioning it either.
Hey, Carmen Perez, do you have anything to say about this?
Is she here?
I thought she was.
Yes, Carmen is there.
Carmen is here. She's muted. Carmen, you'll need to unmute.
Okay.
Sorry. Oh God, it took me a while to even unmute myself. Hello.
Hello, Carmen. Have you been listening to what we're saying? I think we may have been in the middle of it when you came.
Right. Regarding the nursing home beds.
Right. So we're talking about committee goals and, you know, all the stuff we put on, you know, from the last time. It's just a review. Not everything needs to be listed as a goal. It may be something that we do this year, but
Right.
under something else. So we're looking at this nursing home beds item and we're saying several things about it.
All right. Now, my question is, are we still dealing with the situation with the Allure group? Or is that
Yeah, well,
by
yeah,
this
that-
point?
It's, yeah, nothing has happened with the Allure group since the whole pandemic started. But as we said in previous meetings, you know, it still needs to be done. And there are some things we need to find out first.
Right.
So we can still do those things, but, you know, our question is, does it need to be one of the stated goals? So these goals are to be put up on the website, on our website for all the committees and used as a tool for us throughout the year. So of course, that does not mean that we are limited only to achieving our goals this year. There'll be many things that we do this year.
Right.
So since we don't have a good way to state what the goal is, other than these things we need to do, we're thinking of not listing it as a goal.
I mean, because the general issue is that, you know, the District 3 needs nursing home beds, period. As far as the other things, that could probably take another year or two before we can get that going. So at this time, I wouldn't necessarily put it as a priority for, you know, moving forward.
Yeah, so let's not use the word the priority. The word is goal.
Okay. Okay.
There are many priorities that we're going to take care of this year that are not listed in the goals.
Right.
Okay. So from what I'm hearing, we should just put this on the list of things to do. And the things a list to do are fairly clear. Any objections to that? If so, raise your hand or speak up.
No objection.
No objection by me.
No objection.
Fine. So we'll put it at the, just move it down. Okay, next is homelessness. There were many ideas here from Heidi and from Susan.
Well, I don't really think that we can do anything about it. I mean, I think it should be, we should have a strong statement in our district needs. I think if we want to have a panel to hear more specifics like barriers to shelter and that kind of thing, it might be interesting, but I don't think that would be a goal.
Melissa, did you raise your hand?
Yeah, I did. I was about to lower it because I echo everything Susan just said.
Heidi?
I mean, this whole exercise is a bit frustrating for me because it seems like every time we say this is, we're trying to say we want to have goals. And I guess that it should be stated it's realistic goals, and we don't always know individually what's realistic or not. But I also think there's such a thing as stretch goals, and what's the reason that we come to do some of this work at the community board, that we're volunteering our time. For me, that is the goal, to reduce street homelessness. Now, is that 100% achievable in a year? I don't think so. But I think there are things that we can do, what you mentioned earlier, for example, about raising awareness. Like there's other things that will feed into the goal.
Yeah, we're talking about 1 year, Heidi. We're not talking about, what's that goal you called? I'm sorry, we're talking about 1 year goals. That's the only thing we're talking about. So in this 1 year,
what I'm
what would
talking
you
about
like to
too,
see?
May. I'm saying that it's like we're saying there's a goal, but we're not saying, then we kind of back up off of it and say, oh no, but that's not realistic.
Well, Heidi, can you refine it? Because you have more
I
experience.
can't. I don't know how to like make a smaller goal or a
Well,
more
more,
refined goal. I don't have that skill.
a more refined goal.
Or could we say reduce street homelessness through meaningful engagement and advocate for more SROs in the district? Would that be in the ballpark of what we want?
Well, do we want to advocate for more SROs in the
We
district?
absolutely do. Absolutely.
I've heard, that's the one thing I picked up on that I was like, wow, I hear this quite a lot since I've been here.
I've actually suggested that to land use because it's housing and land use. I don't know exactly where it goes because of that. They didn't pick it up. May and I are on emails from this Midtown South group that is advocating, for conversions, hotel conversions.
And they're also advocating for hotels to permanent housing, which is that different from conversions that you're talking
Well,
about?
SROs, I think, there's a large advocacy group in New York City right now for SROs. And they're saying, people don't go into shelters because they're not safe. And if you made, single unit SROs, that would be a lot more homeless people would accept that service. So, the groups are there, the advocacy is there, if you want to join with them and influence in our district.
Well, that sounds like something specific. I'm not an expert in this area. That's why I'm leaning on Susan and Heidi for more.
Although I totally agree with everything Heidi wants to do, I think what we're talking about is an issue of what is a goal and what isn't a goal. And I think what the committees are all doing and have done in the past are achievable specific goals, as opposed to other agenda items that we want to keep working on and certainly want to influence and advocate for.
I've actually been thinking about the problem with the word goal, because what this one here is really, this is like a vision. So yeah, that's a goal, but it's a vision. And then other times goal is, specific and achievable, specific, measurable, and achievable, realistic, time boxed, SMART. It's an acronym that they use in the business world a lot. So is it specific, measurable, achievable? I think realistic is the R, and time boxed. But I don't know what we really mean by that. It's not wrong to have, I suppose, to have a visionary goal, but I kind of think we might want to write it as something that we can measure by the end of it.
If I could just give some background where this isn't something we made up. When Scott Stringer was borough president, he made all the community boards fulfill their charter mandated duty of annual reports, which we no longer do. And as part of the annual reports, the committees had to have goals. And it didn't have to be many, it could be 2 or 3, and they were achievable because the the beginning of the exercise the next year was to evaluate how you achieved your goals from the previous year.
Yeah, so I just want to let you know that I looked at one for, we didn't do this every year, but I looked at one from a few years back. And it was, well, it was for all the committees, not just ours, and it included the exec. So strictly speaking, they weren't goals. They were just a list of things they wanted to do. There were goals behind them, but if a stranger were to come in, they could just take a guess at what the goal was. So for example, a goal for one of the goals for the exec committee, which we actually do now, is we send out these letters about your absences, like, you know, halfway into the year. And it has a goal, right, to, you know, do several things, but the goal was not listed. So, you know, we can, if we're to continue along the same tradition, we may just make a list of things to do. Well, you know, getting back to this homelessness thing, I mean, I've, you know, just this past year, you know, there's been a lot more street homelessness because of the pandemic. And I have heard, you know, from this committee and others that, you know, the safe havens or the SROs are, you know, like Thomas, that, you know, it's really needed.
So can we be specific? And I'm just stretching here. I just want to throw out a number, because in the Department of Ed, when we write goals for the students, it would be like an increase over time. Could we say, even though it might not be necessarily doable, but if we shoot for, let's say, a 5% increase of SROs in a district, or a certain percentage of SROs over traditional shelters to be implemented this year? Is there something we can say like that?
I like the IEP approach there.
You're not going to have any of them implemented this year. I mean, what we always vote as one of our funding priorities to have more safe havens. So that's a funding priority that we advocate for. And we talk about it in our district needs. It takes years, because what you have to do is, the issue is 100% money. That's exactly what the issue is. But you have to put out an RFP, then you have to have a provider answer the RFP. If I'll refer you back to the Orchard Street one, which is now down the drain. But it isn't that the city just goes and builds them.
Mm.
Right, and sometimes we heard also that the owners are charging, you know, they're asking for a lot of rent, and the city can't afford it.
Yeah, it's
With the money they have.
It's a funding issue. It is 100%, as far as safe havens, a funding issue, which we do advocate as a high priority, which is one of the reasons they wanted to put a safe haven in CB3, was because of our budget priority.
Do you think it would help us to be more active, or go to some of those meetings with that coalition that the Midtown South group is involved with?
It wouldn't hurt at all. I mean, I haven't continued going because of time, but if people could go, there's certainly no downside, and you could, you know, always evaluate it and to decide whether to continue going or not.
And then I remembered earlier on, you talked about it, Heidi talked about it, some kind of, this is not around the SROs, but it's like this coordination of service providers.
Well, they're more coordinated than they used to be. But again, and Heidi is the expert on this, what I would suggest on that is more like an agenda item of have people involved, you know, as service providers come talk to about what works and what doesn't work.
Could I make a suggestion? This is Larissa. Just looking over this again and trying to visualize this as an achievable goal. Item number 3 under homeless, the coordinated panel for service providers, that's well defined and it's achievable, and it would also benefit information gathering for our district needs statement, could we use that as the goal? If everyone would agree that would be, that we would keep this as a goal.
What do others say?
Sure. Because then I guess we can take that information and that will inform how we're advocating or not.
I think that's well defined. And it will help us accomplish our goal. Well, it'll help us increase information and advocate for the SROs. And also we could make part of it attending the meetings as well, have a representative at those meetings.
Yeah, those meetings are about, it's a coalition that is advocating for more of the hotel conversions. It's a different,
Yeah,
slightly different topic.
But well, that they're associated with the SROs, and that's something that we definitely want to highlight on our committee.
Well, it sounds okay to me. That sounds okay to everyone else.
How about if we said something like coordinate a panel of service providers to discuss new, I just lost it. It was basically like discussing new how to provide new units for them, new beds for them in the district. Because we know that, you know, the homeless population has been affected and there's been a lot of lack of mental health services as well. But like, we're really looking for a place to have them settled so that they can receive some of these things. So how about coordinate a panel of service providers to discuss establishing, I don't know, more immediate access to beds in the district? Because it seems like we've been talking about that for a while.
It's a funding issue.
So, I mean, I think the number 3 refers to a panel about all this, not just that, but, you know, all the services that are provided to homeless population and the changing landscape since the pandemic.
I'm not clear on what that is. How is that different from the questions we have on all the programs during budget consultations? Is it that you want the service providers to tell us what the city's doing but lacking in what they're doing? Would that be it?
Can the person who came up with that, who wrote number 3, answer the question?
Susan, can you repeat that?
So again, getting to what does this actually mean and how do you do it? When we have budget consults, we certainly at that point ask about all the mental health services and that kind of stuff. So would this panel, would it be people, providers working with the city who would talk about how the city services are lacking, what's still needed, what's lacking and what's still needed? Is that what this is saying?
Yes, but I also think we need homeless advocacy groups as well to come inform us what they're getting from city services and what they're getting from their constituents that they're serving and what they're asking for as well.
You know what I often find useful with these panels is it's a little bit different from budget consults. It's not just to talk about what's lacking as opposed to what's being provided, but simply what they see as like the best practice.
Yeah.
And then I don't know how the landscape has changed, or has it changed, or is it just that, you know, things are highlighted more? That I don't know enough about in terms of homelessness. But, you know, but the best practice thing is something that can't be discussed during budget consults because that's, you know, a little bit more
That's a great point.
about budget consults.
It's a great point. Best practice. Can we incorporate that in there with that goal? How would you word that, Thomas?
Maybe to establish a list of best practices in coordination with service providers to make better informed fiscal decisions in the district, or advocate, for funding for certain things. Like, the best practices we can use to seek out funding sources.
Is that something that's already exists? Or is this something we need to have?
I don't think we would seek out funding sources, right? I mean, that would be the city, right?
Yeah. No, it's like to advocate to the
Advocate how the money should be spent.
how the money should be yeah. Because if we come out with best practices, it's kind of like what the two persons presented about Chinatown. They went to the community and, they kind of got a sample of what was going on, even though it wasn't necessarily a scientific survey, but you could establish some, some policies just based on what they said alone. So we have access to bring a lot of different kinds of people together. We could come up with best practices that reflect the heart of the board, and then hopefully that are articulate to some actions from the policymakers. I mean, the funding people.
I think that's much more well-defined as a goal.
Oh, okay, now we have to type it in.
Could we get comments from Heidi?
Yeah, Heidi?
I'm listening. I think Thomas is on the right path, combined with advocating for the funding to be spent a different way. And right, I do think it's important to hear from the service providers themselves, because they'll tell us all about how DHS isn't doing things that they need, like harm reduction on the streets, for example.
Thank you, Heidi.
I think this is good. You'll notice that I got real quiet when we hit this one, because this is my goal too, and and although it would seem kind of mushy, here's what I kind of think. It's like, you can say a goal is I want to eliminate poverty, or you could say my goal is to establish a guaranteed income program toward the larger goal of ending poverty. One is kind of achievable, and it really describes more what my work in the next year might accomplish. That's not my field. That's not something I'm going to accomplish. But this is a good way to approach this. Maybe, just, blend the two goals together. Sorry, the two ideas of what a goal is. By the way, I'm terrible at this. I have to do goals at work every year. And it's terrible. How can I turn a goal like, I want to get distracted less often by new ideas, into a goal?
Ooh, can I use that next year for my goals?
Okay, so it's just, so Thomas, when you finish typing, we'll just review it one more time.
Okay.
Oh.
Let me know what needs to be tweaked.
Okay, so it's that. Okay, so we're saying establish a list of best practices from service providers and the community to inform funding decisions from city and state agencies.
City, oh, I'm sorry. It would be city agencies, no?
So the state doesn't have a hand in any of the facilities or?
We don't work with, not that I know of, but we don't work with them. We
Got it.
just work with the city.
Okay.
I mean, it's a list. It's something tangible.
That sounds good.
And then we could back it up, we can back it up with statistics or surveys or, it could be something that continues to grow, but is quantifiable.
And this, measurable, absolutely.
Okay, good. All right. I think we can move on to the next one.
All right. I've heard about this Essex Street thing before. This is
Essex
my
Crossing.
first committee meeting, Essex Crossing.
So I rewrote the Essex Crossing thing a little bit, but I made a list of things that we can do this year.
Is the step number 3 perhaps the goal?
We haven't
Part
done
of it?
number 3 yet.
Well, I know,
Well, it's just a
but-
list of things to do, but it's, yeah.
Yeah, but it's a thing that is going to be a process, and it would be a great thing to accomplish. I mean, it's not like, I need to make sure to file my taxes by next Wednesday or whatever. That's something in my control, which is a goal that I probably won't meet.
I think we can achieve this. When we spoke to, May, we spoke with DOE about this, right?
No, we
And
spoke with
HPD.
HPD, right?
And they seemed very hopeful and said they were going to contact DOE, or it was a school construction. So we need to follow up on that. But they, seemed to think it was very possible.
I think it's achievable. I think it's something that needs work to be done. It's not like something it's 100% under our control. So it's not like a step we can take. That's the outcome we want, I think, at least at this
So you
point.
mean like to advocate for that?
Right, to advocate for whatever we have to do to make sure it happens. If it hasn't happened by the end of the year, then, well, that will be a big failure.
Yeah, so I think it is accomplishable. And as Susan says, and as we reported in a previous meeting, we did have an initial meeting with HPD staff, and they were very supportive about getting it extended, but we don't have it in writing. So we need to have it solid. So that what number 3 means is to make sure we have it solid and in writing.
Advocate, the expiration date is extended in writing.
Advocate. We need
Well,
to.
no, we just
you
make
want to
sure
make sure that it gets
no, I
done.
just make
Oh, so
sure
we're
it's
making
actually
sure. All
done.
right.
Yeah, so that we want it to be documented.
Got it.
Yeah, and it's not just a verbal, meeting where, everybody thinks it's a great idea.
I put, make sure the expiration date is extended in writing.
It's extended and documented, yeah.
Looks good to me. The other one might be, we had talked about, there would be the need to change our sort of what was our founding document on this. I don't know what the thing is called, but we had very specific vision about everything in Essex, and there was one very large resolution that passed many years ago. Does that need modification? That's the point of some of the other steps here, I think. Information about the Bleecker School and use as a point of reference. Isn't that about trying to find a suitable kind of a school? Because I don't think we're making progress on the one we asked for.
Well, we tried to hire someone to modify it about 2 or 3 years ago. We just weren't successful. So I don't know how to go about that unless someone has a better contacts.
That was trying to get it modified, our own document, or is there a city document?
No, we tried to get our white paper rewritten so that our arguments were based on different arguments. But we couldn't get it done. We contacted a lot of people, and we just couldn't find anyone to do it for us.
But it's our own white paper, right?
Right.
Okay.
It takes a lot of work. It takes a lot of research and a lot of work, and, you know, understanding schools. It's a lot of work to do that.
Yeah, so updating, we have not updated our paper.
Right. Well, you remember when we tried and tried, and we spent many hours trying to get that done.
I think that maybe I'm mistaken, but I think that that is a necessary step toward getting some new school built. Is it not? I mean, if we don't extend it, we lose the site. So that is obviously goal number one. But if we actually want to achieve getting a school there, I think we do have to redefine the nature of the school we're looking for, so we can make different arguments and get traction.
Well, there's two
It may be
different
hard,
things that.
but
Oh, go ahead.
go ahead.
Well, I mean,
So
it's not a question of being hard. It's a question is, can we do it or can't we do it? We spent, with Jim, May, and I spent a lot of time. Harvey tried to help us. We reached out very, very broadly. I think there were some committee members that gave us contacts, and we just weren't successful. So if someone thinks they could find someone to do it, that's great, but we just weren't successful. Whether it's necessary, I think it would be a good thing. I don't know if it'd be necessary. I don't know that the other schools that were built had that or not. It might be worthwhile finding out.
Yeah, so so it's not, we're not redefining. Well, for us to redefine the kind of school we would want would require more of a process. But we need to do number 3. So it's 2 different things. It's getting the land extended and getting the extension documented. But number 4 is the paper. The thing, talk about the paper, is that we did, there are a few consultants who can do that. And the one that we did have one, but they cost a lot of money, which we did not have. We were not offering enough to this consultant. So it's like that, you may get a lot of responses, but there's only one good response in terms of applicants who want to do this job. And she cost too much money. She just turned it down. She just saw what was needed and she knew what she charged. We talked about what we had and she just walked away and said no. And she was someone who was knowledgeable about the district and the school too. So I don't know what to do about the paper, but the purpose of just getting information, the information about the Bleecker School is just, to see how they got their school or getting their school. But the kind of school they're looking at is not the kind of school we're looking at. So I think unless we have a lot more money, it'll be hard to update the paper. But it doesn't hurt to gather information about other schools that have been built, just to learn their lessons and see how they got their school. So these are steps to be done. They don't have to be written in the final goals. Yeah, Heidi? Oh, Tatiana?
Yeah, I was just thinking because on Tuesday, Naomi mentioned there was like the resolution from a community, I think it was a council on the dyslexia school. And if that's something that we want to include in here, like doing, I don't know, doing research on that. I don't know. It seemed like there was interest. Thomas, maybe you could speak to this too, about this at that meeting on Tuesday.
That's exactly what I was thinking about, Tatiana. It was mentioned, I think the same school idea was mentioned by Shirley last month.
Yeah.
And I thought that what I else heard is that, well, we would have to change the white paper for that, but it may not have been the white paper, but I thought it was something that we would have to have the whole board vote on to be able to consider such a thing.
Yeah, so the way that our vision about the K-8 community school, that's what we said is the kind of school we want. So we did, it was a position that was passed by the board, but how the position came about was also through a community engagement process that CEC1 had engaged in at the time. So they hired, I think it was Lisa Dunn, they hired, they had, so it was quite some time ago, they did, some community engagement meetings with parents who had, it was like a charrette type meeting where parents from CEC1, we did it with them, decided that was the kind of school they wanted. So I know there's, so we would.
If I could just say also, I think, we're two
So
different.
I'm not saying they
things we're
wanted
talking
something
about.
different now, but if they want something different, I mean, we'd have to go through a process.
One is the resolution that about what kind of school we want. That's one thing. And I believe the white paper went into the arguments on why, which was a different thing. So when we were trying to get someone to modify that, it was to modify the research for our arguments on why, which again was different, like May saying, one issue is what type of school, and then the other issue is arguments to try and get it.
Right. So the arguments are based on the building, not the type of school.
Right, exactly.
So at the time we said, it was about, school space and, seats, but we came to realize that that wasn't working. So then we talked about technology, technology and modern schools, modern buildings. So that's always been our thing about the schools, to get the building, And then we said, oh, by the way, we would like this K-8 community school. And we came up with that through this whole process that we had with parents in the area. So regardless of the Bleecker Street School, I mean, if we do get money for a consultant, we can still, attempt to update it with, newer arguments as to why there should be a new building.
Well, the CEC did present, they had a presentation on the need for services for dyslexic students in general ed and special education. And they spoke about the lack of specificity of those kind of programs. I did remember Naomi mentioning as well a school in Staten Island that actually used this paradigm, and like the school is like bursting at the seams now. So it does seem like there's a need. I don't know if that would need to be incorporated in a new document, but it is a viable need in the community.
Yeah, and I've heard about it being talked about in the past, in the recent past, and even Naomi has mentioned it herself. So I think that we don't need to discuss it more tonight. And yeah, it's for a larger discussion at a later time. So for this year, as far as the school Essex crossing, I think it's good enough if we just try to get the land extended. Susan will tell you our budget doesn't look very good this coming year. I mean, the CB's budget, but so how does everyone feel about that? We'll get the land extended, and in the meantime, we'll continue conversations with, CEC about, schools in general.
Yeah, I agree with that. Sounds good.
It's a better refined goal.
Yes, I think that's a fair goal.
Okay, so let's just move on to the next thing.
K through 12 students in CD3 with IEPs. we did the first one.
Well, what do you think needs to be done here?
Do you think we can actually achieve number 2 by June 2021, end of June? We're already well into May right now.
I don't know what number 2 means. What does number 2 mean?
Well, under this goal, item number 2, generate questions about IEPs from DOE on those committees and those on committee proficient in this area. And the timeline is set for June 2021. And this is definitely an achievable goal, but can we achieve it by June?
What are you going to do with the questions?
Yeah, that's the open-ended question right there. How are we going to utilize these?
Well, I think the IEP, we put information out there. I think as we continue, there'll be more parents that we could probably point them to the right direction with them. Because Tatiana provided a great list of resources for the families who attended. I know that there's a lot of talk about social emotional learning when we re-enter the schools, and there was supposed to be social workers dispatched to every school. I don't know how the DOE plans to make that happen, but it is a serious issue as we're going to go back full throttle in September. So I don't know if we want to do some kind of a goal related to school reentry and social emotional learning.
What are you envisioning, Thomas? Like an event or?
No, well, I'm thinking more, how can we call the city to question about the distribution of social workers in every school? How is it going to happen for co-located schools? Will each individual school in that campus receive a counselor? Because it's right now the counselors are very sparse. I happen to be in a District 75 school, so we take it for granted that we have guidance counselors. I have 4 counselors, but some schools don't even have one, or they're sharing counselors. So the social workers were supposed to be dispatched, and they were promised to be sent to every school, but we don't know how it's going to happen. There's been no specific plan from the DOE. Just like the Summer Rising program, they say, hey, bring all the kids, but busing hasn't been established. Students with IEPs have not been given a transfer to an adequate person who can take care of them in some cases. Like if a student's emotionally disturbed and then they go to Summer Rising, they're not going to stop being emotionally disturbed when they go to Summer Rising.
Yeah, you know what? Yeah.
Person there.
Right. Yeah, Thomas, I'm thinking that, well, what's the problem? Is there some problem we want to address? Because I think this for students with IEPs and, various learning disabilities, they're always kind of forgotten. And quite frankly, some of these programs like Summer Rising, it's nothing more just a repackaging of programs that exist. I went to a meeting, I went to a budget, and the DYCD commissioner admitted that's all it is. It's nothing more than repackaging of what already exists. And then they make a big deal out of it. And it's just to market it, to bring more parents and, more families into participating in these programs that already exist for the summer. Now, is it being rolled out really well? Not very well, but
So I just, if I could add something, I'm just thinking, so a lot of school districts across the country are considering, this is it has to do with the social and emotional wellness. I think that's super important. And I think we really do need to investigate how they're rolling this out and how they're supporting our students, you know, kind of what their plan is. And then I think we also need to think about, you know, we haven't seen a single announcement about options for students next year. And so what I've been hearing from schools across the Northeast, at least, there's districts that are offering, you know, where high school students have come to present that, you know, in some cases, they're better off learning remotely and they'd rather learn remotely. They're more effective. Certain students with behavioral issues or other issues in the classroom, social issues, anxiety, are doing better under remote learning. So we haven't seen really any kind of messaging around what their plan is for the fall and how they're thinking about how are we accommodating our students, both the ones that are better off staying home or better off being remote, and the ones that need more supports to actually go to school. And then that whole social work issue about the students that actually do go to school and are having issues around being in school. And I think there's a whole piece around here that needs to be addressed. And I don't know how it's part of our goals, but I just wanted to really just bring that out. You know, whether we need panels of students to come and speak to us and, you know, determine what's needed, or parents, or, you know, deans. I'm not sure, but I think, you know, that this whole, what we're going to face in September is going to be, you know, a vast variety of needs. And I haven't seen anything from the DOE offering any kind of alternatives. Like I work with a large county in Maryland, 67,000, it's not as big as New York, it's not a million students, but they had students come and present to their board saying, you know, we're better off at home. Some of us are better off at home and you need to give us that option. So I just want to see a more clear pathway from the DOE about their plan to deal with all the social emotional issues that are going to come up in the fall.
Do you think, okay, well, they never have a clear pathway. Do you think that it, do you think, okay, school is opening soon. And do you think this is something going to continue after school open? And do you think the need is that there needs to be more like student or parent or family input before, you know, DOE rolls out these programs? And is that something that we can do about?
I think
Well,
you're going to need.
I mean, it's a lot of different things. It's the family parent side, and then there's the teacher and school and student side. I mean, the teacher and administrator side.
I think the parents are going to need more assistance once it gets started.
I agree.
Because you know it's going to be rolling out differently every couple of weeks when we initially start.
Mm-hmm.
So just somehow, how do we I don't know.
So what can the community board do? I mean,
Can I ask?
Yeah,
What,
go ahead.
I would say, first of all, I'd say, what is CEC1 doing? Because we want to support their work, not duplicate it. I don't know what they're doing, but it sounds to me like a lot of things we're talking about are very likely what they are talking about, and they're much closer since they're daily, you know, working with the parents. I think we're talking about a lot of stuff beyond what a community board does. As opposed to what a CEC does, you know, what the CEC does. And, you know, maybe we need to update with them on what's going on.
Good question. I don't know.
Well, no, and I wouldn't expect anyone here to know. I mean, I was just thinking maybe that's something we could do is, you know, get an update from them. And it might be also very helpful, you know, we're writing our district needs anyway to, you know, we want the information from them on what they see as the needs and questions even for budget consults.
Yeah, some of the social worker stuff is related to budget consults. That was, they never had enough money for social workers. That's why there isn't a social worker in your school.
And now they've been funded. They've been funded from the federal government, but how are they going to be distributed? That was a concern that came up. So they just say, hey, you're going to get it, you're going to get it. But like I said, what do you do with multi-campus schools? There's just, is there going to be a certain amount of social workers per kid? You're going to have one social worker for 2,000 kids. It's not explicitly put out there. So
do you think that our area is because of we run into this issue a lot where our area is not seen as a high needs area?
Well,
like there were social workers last year, and they're all like went up to some program in the Bronx. Not that they don't need it, but we didn't see any of that.
It's a zip code issue. And it's been a zip code issue for years, and it's getting much worse. That's gentrification. But we're getting very far away, very, very, very far away from just having a few goals to work on.
Yeah, and I'm just trying to,
Well, I mean, let me just throw this out there. Since we did a resource fair for parents, I thought that was a specific way to deal with a need. Would we entertain possibly doing something in the fall to assess and to meet the needs of the parents upon reentry? Because I'm a parent, I have 2 kids at P63. I get way different messages from them than I actually do in my school, which is across the street. So there would have to be some kind of forum so that these parents could be informed for the ones in the school, and possibly persons from the districts, like the superintendents could speak to, I don't know what a community board lies with that, because I know schools themselves host town halls and things, but we could be a resource for parents who don't have something. We can have people on deck who can give them what they need through the panelists, and then putting together resources again.
I think Susan's right here in that I think that sounds like a great idea, but I do think that like the CEC is probably already planning events like this. Like there'll probably be multiple events like this, and we could promote that as well. And maybe in September, we want to invite a speaker or something to speak specifically about school reopening. And then like put that, like tell parents or people about that. And that can be kind of our part. And I don't know, maybe we are co-sponsoring something with CC, but I do think they're probably going to be doing multiple things like this with parents. But that's just my 2 cents.
Well, I think they would too. I don't think we need to.
Do we want to keep this as a goal?
I mean, in terms of a community board, besides co-sponsoring these events with CEC, the only thing I can think of is that we, highlight or highlight some sort of a need. Bring attention to something.
Could a goal be that we are committing to work more closely with CC1 on these issues, or is that too loose?
No, it can be.
Or is that not really a goal?
I think it was a past goal, and we really did work on it and got a lot of better. Maybe maintaining a close relationship with CEC. Is a good thing to focus on, and it could be a goal, right?
I mean, we had that goal in the past, and I think we've kind of done that already. But
well, it focused, but when that goal focused us on doing that, and it was successful.
So do we still need to do more on that?
Well, the whole thing that came up with the IEPs was just making sure that they were given out equitably. So when we had the meeting, when we had the resource fair the other day, there was a parent who was not receiving the same services because the child was remote. And the parent was not aware that there were resources that could have been brought to the home, including teletherapy, with actual physical therapists to go to attend to her child. And it was good that our panelists were able to address that need. So, you know, there's still these things that go on with the IEPs. I know just on a micro level at my school, what we've been doing is really promoting students to the highest academic level they can achieve. Now we have actual 4 District 75 kids have transitioned and are getting Regents diplomas this year. So on our side, we did an inventory in-house of students why are they here? You know, some of these kids were just there because of trauma. They weren't there because they were intellectually disabled from functioning in a gen ed curriculum. So there's still that kind of like, and what somebody said at the resource fair says, I have to trust the staff members that are working with my child because I don't have another point of reference.
Oh, so Thomas, let me interrupt you. So so structurally, do District 75 schools, it's different from District 1, right?
Yeah.
So do they interact with District 1, or are you saying there's a need for something that's just for District 75 schools, and how many of those schools are in our area?
I think there's tremendous crossover because there are students with IEPs in District 1, but for example, the students in my program are considered alternate assessment. So they're not getting.
Yeah, no, I'm trying to figure out what the need is. So you're saying that District 75, like no one's.
I'm saying there's a need for
because it's getting, yeah, go ahead. I just want to figure something out because it is getting a little bit late. So that's why I'm trying to come to a conclusion about this.
I mean, if you don't mind, I can articulate a better goal and email it to yourself and to Susan and see if it, you know, we could present it to the committee if they want to put it on. But right now, it's not. I don't have a clear thing because we've been servicing these students all year. We were the only program that was operating during the pandemic initially.
Yeah, so what I'm saying is that, you know, District 1, they take care of a lot of their students, but there are some students that they're not able to take care of, for example, you know, for organizational or DOE structure reasons, then that may be a gap that we could fill if that's what you're looking at. Okay, so why don't you think about the goal more, and maybe we can, well, we have till the end of the month. If we have something, let's do this. If we have something, I mean, we don't have to vote on this, but if we have something, we put it in, and then should I run it by some people in the committee, and how does everyone want to handle this?
Yeah, that sounds good. I'm happy to work with you, Thomas, on that.
Okay.
All right. Okay, so can we just review this whole thing one more time? All the goals? Just to make sure we're all on the same page.
Oh, that was our last one. Okay, no problem.
Okay, so number 1, identify the social inequities facing the district, including the district needs.
Is that correct? Did I capture what was said?
I believe so.
Okay.
The wording is a little weird, but
Yeah, the wording is weird.
into the district needs, including the district needs.
So that can be used in the district needs or other advocacy. So identify the social inequities facing the district that can be used in the district needs statement or other advocacy.
Get rid of the word including and those.
So that can be included.
Including.
Get rid of, that can be included.
Oh, yeah.
Cut the word including.
Including, okay.
and cut the word those.
That can be, okay. Is that better? Do you want to tweak it further?
How does that sound, everyone? Any objections? Hearing none. So we can move on.
Homelessness.
Okay, establish a list of best practices from service providers and the community to inform funding decisions from city agencies. Any changes or objections? Heidi, are you okay with that?
Yeah, sounds good.
Okay, great.
And then the third one, Essex.
Okay, make sure the expiration date is extended and the expiration is documented, right? I mean, that the date is documented. Documented in, yeah. Is that correct, Susan? I think she's not here. All right. Okay, next, okay, and then finally, the K through 12 schools, Thomas is going to come up. Thomas and Tatiana will come up with something.
Mhm.
And we'll review. Okay, so that finishes this part of the agenda. And we will move on to the next thing. Can we skip around a little bit and review the district needs?
Would you like me to
Susan,
share
are you?
that?
Oh, wait, is Susan here?
I don't see her on.
Well, she was supposed to review something. Okay, let's see if she comes back.
Yeah. No, Susan put in the chat, good night all.
Okay. All right. Okay, so we were supposed, okay, so let's go skip around and go to the district needs statement. So I emailed it out to everyone. It's the district needs statement from last year. And we want to identify, so this year we're not doing a wholesale rewrite, but we just want to identify the areas that need to be updated. That's all we're doing today. Oh, Thomas, do you have the district needs?
I have it up if you want me to share it, or do you need Thomas too so we can edit it? What's your preference, May?
We're not going to do
Oh.
much editing. We're just going to
Yeah.
identify the
Okay, I'll
areas
share it
that,
then. Yeah, I'll
that
share
need
it.
to be changed. Oh, that
share
need
that then.
updating. So it should just take a few minutes.
Sure, I can highlight whatever needs to be highlighted.
Okay. All right, so this is the whole our part of the district needs from last year. So we had 3 different sections. The first one was education. Later, we had one on health. We had something on youth. Okay, so just take a quick look. If you see areas you think that need to be, right away, you can see that it needs to be updated. You don't have to have the information right now, but you just look at it and you can see that it's being updated. Just please call out. So there's the one on education. So last year we said the priority needs were social workers, counselors, and technology. and something else, which I can't see. And after school.
After school.
Any comments on this or what you think needs to be updated? Or is there some overall thing like all the statistics need to be updated?
Probably, I would imagine the social workers section will need to be, maybe could be supported with some more like data from COVID.
Okay, so, okay.
Yeah, I agree. I think most stats need to be updated.
There still hasn't been an improvement with the Wi-Fi, but more devices have been distributed. So I don't, I think that that need is still relevant.
Agreed.
Yeah, I mean, if there's changes in the school, like, there's gonna be more, I mean, students will be back in school, but, back in person one day, but if somehow there is more at-home remote learning, then that should be reflected.
Yeah, there's still going to be a need because quite possibly schools could still be shutting down if there's
Plus-
other strands of the.
And not just that, they're talking about the snow days as well, moving to the remote
Correct.
model for snow days.
There are no more snow days.
There was a
Stop.
collective
It's already
cry.
taken off, so
Yeah.
it would be moved to remote learning.
Yeah, there
And-
was a collective cry that went up throughout the city the day that was announced.
Oh,
I have
wow.
no sympathy. When I was a child, we prayed and prayed for snow days down in
No,
Dallas.
no,
We
that
barely
was
ever
from
got
the
them.
parents.
Oh, that,
I
okay,
do
yeah.
get it. I do get it.
Educators
kidding.
want snow days more than the students, trust
There
me.
you
Yeah,
go.
snow day, yes.
Kids like to hang out with their friends.
Okay. All right, so let's move on. Okay, the new school.
I don't think anything's changed from that.
No. Okay, you can keep on going. Okay, so let's get an update. Okay, so maybe we should get an update. We don't need, we need to get an update on NYCHA. So I will ask Susan what she's heard about these NYCHA facilities, and maybe the land use committee might know, what kind of maintenance they've had or since in this past year, if any. I don't know if this income requirement thing has been fixed or not.
Mm.
Does anyone know? Okay, cool. Yeah, so let's ask about the. Yeah, so let's get, we'll get an update on all these things and see if the pay disparity and what's going on with it, because that was all from last year. The senior citizens, and we're gonna update the statistics, right?
Yeah.
Hey, Carmen.
Yes.
Carmen, do you, is that something that you have?
Sorry, for some reason the mute button here is not working properly. Yeah, we're gonna have to change the statistics.
Okay. Oh,
And
senior centers,
senior
New York.
centers are supposed to open next week. Let's see. There's one more ask to put in there, especially due to the pandemic. And that is more funding so that seniors can be more technologically on par with everything else. Because this, judging from last year in quarantine, many of the events that took place were all Zoom, and most of the seniors weren't able to participate due to the lack of technology.
Right, so for this coming year, in terms of district needs and the senior centers, are you saying they need more technology?
Absolutely.
For seniors to use at home or at the center?
Both, because
Okay.
at this point they're gonna have to, even if they are in there, they're gonna have to be more socially distanced.
Oh, I see, okay.
Would that also include training?
Yes.
Okay, Paul, did you raise your hand? Oh, yes. you did.
Yes, I just raised my hand. I think I know we still have a little while before we really submit the district needs. You may want to just put a whole new section in about technology, and because it affects a bunch of different communities, different youth, education, seniors. It may be something that needs to be put in on its own, and we hit all the bullet points underneath it.
I second that. That's absolutely correct, because there's such a digital divide here in the Lower East Side. The comptroller's office reports almost 50% of the Lower East Side doesn't have proper broadband.
It's a direct human service at this point. It just goes across everything.
Yeah,
I agree.
I agree with
At
that.
this point, it should almost be considered a public utility.
Absolutely.
Yeah.
Okay,
Yeah, so tech should be its own section now. It's grown to that level.
so it's about tech as it,
Tech as it affects the entire district.
so you mean,
In our committee, right? Under seniors, under youth, under education,
Mhm.
everywhere. Even when senior centers, even when they reopen, what's the tech situation going to be like in there? They're going to have good Wi-Fi connections. I'm sure there's still going to be Zoom classes and things like that pop up, because not everybody's going to want to come out. So we're going to have to make sure we really hit that hard on the district needs statement, like put a pretty extensive paragraph and bullet points together.
Yeah, there was a discussion about that this past Tuesday. So it's definitely going to be a need.
yeah, let's see how, let's just add that in. So either that or as a part of every section, if we organize it by sections as we have it, like the sections we have now,
Or give it its own section.
yeah, I'll give it its own.
right, but they might be a little bit different in each section.
No, we're pretty much asking for the same thing.
It's going to be pretty uniform, but I hear you, man. I think it's still going to be pretty uniform on a lot of stuff. Like it's going to be included in health. It's going to telehealth and all that stuff. You're going to get a lot of stuff you're going to need the tech on. Whether it's Wi-Fi connections, computers, laptops, tablets.
Maybe we could work.
It runs the gamut.
Yeah, maybe we could work on the wording of that at some point.
Yeah, I don't know if tonight's the night for that, but
No.
this is something we should start thinking about.
All right.
But I agree, tech section needs to be added. It's pervasive in every aspect of every citizen's life now.
Okay, so let's move on. When I was looking at healthcare needs and services, I feel like we needed to update the mental health part a little bit more. The mental health part combined with that drug use thing. Yeah, so they're just, that's the only comment I have on health.
Sorry, what? Let me see if I
The
can
mental
find
health.
mental.
Yeah, what we call it, behavioral health services.
Effective mental health outreach.
It's not just outreach, it's,
Mhm. Mental health here, mental health services, yes.
okay.
Yep, I got it.
Okay, so we need to update the information on food security. And then the homeless population, it's, Heidi, did you have any ideas about it being updated, or you want to look at it later? Is it just the statistics?
Yeah, probably the statistics are changed, probably especially the parts on street homeless. I don't know. Yeah, I mean, I assume so.
There's a lot more, right?
2016.
Okay. Hey, Ricky, would you say that the mental health part of the health needs to be updated a great deal more?
I don't know if I have enough, like, background to say whether or not it needs more or not.
Or maybe it just, okay. Okay, nothing has changed. Okay, just keep going. Oh, well, this. Okay, so let's maybe Susan and, oh, Susan's not here, but I know Susan had worked and Heidi had worked on the homelessness section last year a lot. So if you can update whatever needs to be updated for this year.
Sure.
Okay, any other comments on this, on the district needs? Tati?
Yeah, maybe the food security section needs to be updated. I just feel like that's going to be like an ongoing need that I'm sure there's like things that we've learned. Okay, it's already highlighted. Okay. I don't know.
Okay, any volunteers in updating some of these sections?
Food security.
Okay. Anybody else?
And the technology.
When does this have to be done by? I can look for some statistics for the education section.
Oh, we have a little bit more time.
Okay.
Yeah, Susan was going to give us, I mean, she left early, but she was going to give us a whole, the timeline about, you know, when it has to be done by.
Okay.
So we don't have a lot of time, but we, you know, it's, we have until like August, I think. August or July. Yeah, so if you want to help with updating Tati, the education statistics.
Yep.
Okay. Health. Okay, Carmen is going to do seniors, but health.
May, this is Larissa. I could help out with the health section.
Okay. Yeah, I could also do some, it's a big section. I could do some of it too.
That would be great. Yeah, there's a lot of aspects in the health section.
Yeah, we may need to. Okay, is there anything else? Is there anything else? I can't see the whole thing. Are we at the end of it?
We're at the end. The last was
Okay.
the homeless in the parks.
Okay. Okay, so we'll move on to our next agenda item. Or is there any updates from the CABs or CECs that we need to know about?
Okay, May, I attended the Gouverneur Cab this week. It was a really uplifting meeting. We talked a lot about the fact that the positivity rates continue to steadily decline. Deaths also are declining. They are doing in-person visits for the residents there. They continue to help advocate for having everyone vaccinated. I know that they had 100% of their residents vaccinated. And they're encouraging everyone to talk to people about getting vaccinated, especially helping those who are hesitant, who have fears or concerns, help them find resources to help them understand what the risks are, what the benefits are, and help everyone get to that point. I also attended the Council of Cabs where they echoed that. They have put out a series of videos which are very informative. They used people in the community and people on the Council of Cabs in the videos to make it a little more personable. And they are pushing that out on social media and encouraging the community boards also to distribute those videos.
Okay, thank you. Okay, so I think we're at the end of our meeting, right?
We are at the end of the agenda.
Okay, so is there any, okay, so in terms of new business, new and old business, you know, for the next meeting, I think we'll be talking more about district needs for sure. I think we might have a presentation from BioBus. They want to present on, you know, they haven't sent an email yet, but they might, they asked about coming to a meeting. They had, you know, they're doing a lot of programs in the schools. And then finally, you know, remember that school, the Institute for Collaborative Education, I think it's called ICE. Now they're called NYICE. But they asked about coming to present to our committee. You know, Dominic Berg has a kid who goes there, or I think the kid graduated, but his neighbors still have kids who go there. And they asked about, they know that the Marta Valley moved out of the school, out of their building. And they wanted to know about, these are the parents, not the principal. The parent asked about it moving into that, about ICE school moving into that building. So it sounds like they haven't talked to DOE, and they're just trying to get some committee board support. But I told him and Dominic that, Dominic wanted to know if we could put it on the agenda. So I said that there should be a presentation. And I'm sure the committee would have lots of questions. And so they're supposed to see if the principal wants to come and give a presentation. That's all I know. And I know there's at least 2 other schools still in the building because it used to be 3. So that's all I know about that. So we shall see. Any questions? Okay. Okay, so we're going to have the final roll call vote to adjourn.
Okay, everybody. May Lee,
Yes.
Larissa,
Yes.
David,
Yes.
Eric,
Yes.
Shirley,
Yes.
Deborah.
Oh, she's not here. She's not here.
Tatiana,
Yes.
Paul,
Yeah.
Heidi,
Yes.
Ricky,
Yes.
and Carmen.
Yes.
Thank you.
Okay, that's it. And so that adjourns the meeting. So good night, everyone.